and start.
Before you get started, Deborah, are you on the phone?
Hello?
Yes, ma'am, I'm dialed in.
Okay, will you
Okay.
put Deborah Lou on the list? Okay, I'm sorry, I just want to make sure they're not allowed to travel, you know, Austin is shut down, and so they're all working from home, so she's gonna give her financial report over the phone, so.
Okay. Call to order, roll call. Everybody's present, Belinda, Irvin, Billy, Sandy, and myself. Minutes from previous meeting on the 24th of February. Everybody have a chance to read it? Yes, ma'am. Do we have a
Make a motion to accept it.
motion accepted? Billy?
I'll second.
Sandy second. So all in favor of accepting the minutes as read or as presented? All in favor. Open forum. The only thing I would like to, this is just kind of a side note, we used to have prayer in our meetings when we start.
I was thinking about that the other day.
I would like for us to reinstigate that. Does anybody have a problem with that?
I think it's wonderful.
Will we have a,
So do an
Prayer.
invocation before the call to order?
yes.
Okay.
So at our next meeting, we'll have an invocation, if that's okay.
Sounds fine.
Sounds good.
Awesome,
Yes.
thank you.
I think with everything going on, and as strong as our belief is in God and in this body of this group here, I think it would be a good testament. So, okay.
Strongest thing we can do.
Yes. Okay, anything else on open forum? Okay. Audited financial report from BKD.
All right, Miss Deborah.
Deborah, you're on.
Okay, guys, this kind of is an awkward situation, and I truly apologize. COVID-19 has pretty much put all of our BKD team in our homes, and it's asked not to travel, and Billy was gracious enough to let me just be able to do this over the phone to keep, number one, the group of people in Altamont under 10, but also keeping our BKD rules kind of intact, trying to protect COVID-19. So I'd like to do what I normally do, and that's kind of talk about what's going on in healthcare, because there's a lot. And I'm not even going to talk about COVID-19. I think there's plenty to talk about on the financial side long before we get to COVID-19. And then we'll kind of jump into the audit report, and I'll turn you to some pages. Can y'all hear me okay?
Yes.
Yeah.
Okay. So the big talk of discussion, what's going on in healthcare, is a whole lot to do with the Medicaid 1115 waiver. And I believe you guys know over the years that there's been financial success, profitability for the 1115 waiver supplemental payment. But demonstration year 9 was the first year that the definition of uncompensated care actually changed. So we've got two things going on. Your fiscal year 20 will be the first year that your UC uncompensated care is calculated on the new definition. And the new definition changes. We used to take dollars from charges from patients with no third-party health insurance at all, now to uninsured patients who meet the definition of your charity care policy. So the expectation is there will be less people that qualify based on the new definition than what was previously out in the calculation. So I think the dollars are expected to come down, and that's a statewide issue. So number one, starting in fiscal year 20, your funding expected to be lower for UC. And then we've got even another problem with previous years, and that was your fiscal year 17 and your fiscal year 18 payments were paid based on a calculation that HHSC may be required to change based on a reversal of a lawsuit from the Children's Hospital case that was overturned back in November of 2019. Currently, you been paid about net $385,000 more than what the U.S. District Court of Appeals is saying that you probably should. The only thing we don't know yet is if the judge is going to make his decision prospectively, which would mean just going forward as opposed to retroactive. So there is a potential recoupment, and there's discussion on page 19 of your audit about that number and the lawsuit and such. So not only going forward are there lower payments, but there's just this possibility looming over us that the judge will make us retroactively repay. The reason that COVID-19 doesn't have anything to do, I'm afraid, with that chat lawsuit being overturned is because there's no additional money. There's no additional money that the state is going to have to pay back to the federal government. It's just a redistribution of the same dollars within the hospitals in Texas. So whatever you have to repay, someone else will get. And the gist of that is, honestly, the rural hospitals will end up paying about $200 million to the urban hospitals in this reshuffling for the last 2 years. So there's a big fight going on right now whether or not they're going to make you guys repay that to the urban hospitals. The other thing in the 1115 waiver that's changing, and you guys will certainly suffer from this, and that there's $0 allocated for district funding in your fiscal year 21 year. So going forward in district, this is your last year for funding to be available. Now, many people speculate that the government will put more dollars into that program, but currently, if we had to put it in our budget, it would be $0 for fiscal year 2021. The last thing regarding the 1115 waiver that's a great concern, and that is the new Medicare fiscal accountability rule that's come about. President Trump and his administration are requiring a lot more transparency across the board in the healthcare industry. And so one of the things that he's putting out is the states have to be way more transparent to get the federal dollars under all the IGP programs for supplemental payments. That in itself is something we can all live with because transparency is not the problem. But under that rule, the definition of public funds currently is you could do no more IGTs than what your tax revenues are for your fiscal year. And so for you, that would limit you at about $1.3 million going forward with intergovernmental transfers to participate in all of these different supplemental payment programs. And I think that historically you would have extended that amount or more in the past. So that may limit the benefit for you under those programs. There's not a good story to talk about regarding the 1115 waiver dollars. In every aspect, there's concern that those dollars will go down going forward. When you talk to HHSC and say, what's going to happen, they tell you that there's a new program called URIP that is supposed to make up the difference statewide for the reduction in the UC payments. And I would tell you that the story for most of my rural hospitals is that there's no way those URIP dollars are going to come close to replacing what we expect to lose in UC. So I don't mean to tell you a terrible story. I do want you to be fiscally aware, financially aware that we potentially have less dollars in the next couple of years for the 1115 waiver. The other thing that's going on in healthcare that's really big and important for you to know, and I think this will help you. I think this is important to know that your that your software system can accommodate some of this. Is along with the Trump transparency in the supplemental payment, he also is requiring transparency in pricing from hospitals to patients. So starting January of 2019, and I know that y'all did this, you were required to publish your facility's pricing on your website. and I know that you did that. The next step with that is to start actually being able to put information on your website for patients to be able to determine, based on their insurance, what would their out-of-pocket costs be. And so there's an enormous amount of information now that's going to have to go on your website, breaking down your different charges related to different vendors, whether that's Blue Cross Blue Shield, whether that's Aetna, whether that's United, all of the different insurance carriers that you have. You'll have to post what the charge is for patients to receive services for those from your hospital. And all of that is required to be reported effective January 1st, 2021. So that's just seriously right around the corner. So I don't have any good news when it comes to what's going on in healthcare, unfortunately, and none of that is related to the concerns that I think you might have with losing revenue for non-emergent services in your hospital going forward under COVID-19. So if I really only got to, do a quick overview, here's what I would tell you. Unfortunately, cash at the end of 9/30/19 is down. It's down almost $700,000, and we're going to look at that on the balance sheet. The year on paper really does not look near as good as what your 2018 year looks like. Gross patient service revenues are down over $300,000. Now, I would tell you that management continues to contend that they're not lost revenues, that we provided the service for inpatient, outpatient, and clinic, but that our software system, Athena, did not record it on the trial balance properly and did not bill it properly, consistent with the previous years. But those numbers don't show up. There's lost revenue, whether we actually provided the service or not. I don't know that we can provide the detail to be able to tell you that that occurred or not. When we switched to Athena in September of 2018, our fiscal year 18 numbers really only had maybe a week, 10 days. Is that right, Billy?
Yeah, it was about a week.
That fiscal year.
Mm-hmm.
So we really can say fiscal year 19 is 100% Athena. So we really didn't see any significant impact to our 2018 year. 2019 shows lost revenue of about $329,000. Billy seems to think it's more than that. When it comes down to it, our net patient service revenue was down $200,000. So we literally had $200,000 less cash from patient services than we had in 2019. And our benefit under the 340B program was lower, so our overall net patient service revenue was down about $200,000. So when we talk about where did our cash go, $300,000 is what was less than previous year coming in the door. Overall operating expenses were up about $150,000, and all of that is sitting in salary and wages and benefits and special services. So the entire amount of the increase is based on the people that we paid. There are some other areas that went down to net $150,000, and we'll look at that detail in here in just a minute as well. So our overall operating loss went up about $475,000. So when we asked where the cash go, it was less financial profit from the hospital, and our overall profit, or our overall loss for the year was $431,737. So it was a loss of about $400,000. So kind of looking into specifics, let's go ahead and turn, if you will, to page 9 in your audit report. So which is the bound report, which you can, not the letter that's stapled together, but the audit report is bound. Can y'all turn to page 8? Let me know when y'all are there.
Yeah.
We're there.
Okay. So if you look at the top cash and short-term certificates of deposit, both are down. Cash is down from 391,000 down to 175,000, and all of the CDs of 469,000 have been expired, used, for a total cash decline of 684,000 compared to the prior year. The other thing that's happened is the patient accounts receivable, cash we expect to collect in the future, is also down 440,000. At the end of 2018, we expected cash from patient services of 885,000, and at the end of 19, that's 440,000. So there's less cash at the end of 9/30/18 expected to come in from patients compared to the previous year. To flip that a little bit, the estimated amount due from third parties was up. So there are other areas that we expected cash to come in the door. Previous year, it was 613,000 expected from third-party payers. In 2019, that's about $1.1 million. The breakout of how that of what that's comprised of is you were expecting about 92,000 from your Viscrit project. There was a benefit of about $302,000 prepaid on the service organization payments to your physicians. And then there was an expected $626,000 from your cost report from Medicare. When we talk about that $600,000 settlement to be received from your cost report, I will tell you, there was great concern going in even to the last hour. Billy and her team were all working with us at the last hour, if you will, to try to get as much valuable information out of the Athena system as we could. I will tell you with confidence, I don't know that the information that we've used to complete that cost report is right. But I can also tell you that management exhausted themselves trying to figure out how to get us anything better. So 18 months, 2 years from now, Billy, what we have to be really concerned about is what will we be asked under the Medicare audit, the tentative audit. Will we be required to submit any additional information will be the biggest concern at this point, because I don't think we can get any better information than we've used to complete those numbers.
Right, I agree.
The other thing is net capital assets was up, and certainly we all know that that's coming from the nursing home program or project. I'm looking at the page. So if you'll turn to page 20, you can clearly see that at the end of 9/30/19, there was still $3.8 million of construction in progress. And the lion's share of that's related to the nursing home project. So overall, if I look at the bottom line of total assets, overall our assets went down 9.8 million, from 9.8 million down to 9.674 million. So things are netting up and things are netting down, but probably my biggest concern that you guys will talk about later and probably have had to deal with long after the 9/30 year end, and that's the reduction in cash. If you'll then turn to the liability side, the biggest change that I guess I'm concerned about is the increase in the accounts payable balance from 202,000 up to 868,000. Clearly, you see the change in cash affecting the payables at year end. At the end of 2018, you owed $167,000 to third-party payers that you don't owe now, so that's zero. And at the end of 2018, you had accrued payroll and benefits of 265, whereas this year it's 100,000 less at 165. So overall, your current liabilities are up $345,000. So at the time cash is down, you've got liabilities that are growing. I guess the good news in all of this, and I'm going to make it be good news, you can take lemons and make them into lemonade. The long-term debt has gone down about $220,000, so that you are in fact making payments on that bond note. The sad part is that you're making payments on a building you're not producing any revenue from yet. So we need to talk about that at the end going forward, how we can start making that happen. If you look at the change in net position towards the bottom of the page, it went down from 4.5 million down to 4.1 million, and that's the net loss we're about to look at. Everybody okay?
Yes.
Okay. If you'll turn then to page 10, I think page 10 tells the biggest story of what happened in the financial position. So net patient service revenues at the end of 18 for the year were 8.4 million. And at the end of 2019, it's 8,208,000. So we're down. There's that net $204,000 of less patient service revenue. I do think that Billy believes strongly that that number is down because we did not bill for services that we provided. We found no evidence that that's true or false, but she believes strongly that there was a problem that resulted in that. When you look at the reduction of other revenue, down 149,000 down to 35,000, that reduction, the lion's share of that's the reduction of 340B revenue. Salary and wages are up. They went from 4.8 million to 5.1 million, 5,063,000. Most of that looks like it's a 3% pay increase for the year. That's what most of the increase consumes. And then there were purchase services and professional fees that went up. And when I look at what's in there, it's a lot of additional administrative costs. And I'm going to go under the assumption right now that that has a lot to do with the nursing home project. Supplies and other are down. When I look into why that's the case, I can see that y'all changed vendors for supplies and are getting much better pricing on your supplies. It's hard to tell. Normally, and Billy and I had this conversation, normally when I see supply costs going down, I think we provided less services than the previous year. But the fact that there's a change in the vendor and the supply costs were lower, I can attribute some of that reduction in costs because of that as opposed to providing less services. So Billy's argument that there were not less services from the previous year still can hold true. So if you go all the way down to the third from the bottom, at the end of 18, our profit was $20,055, and our 2019 income is $431,737,000 loss. The question that you would ask is, Deborah, what adjustments did you make? And while there were an assortment of adjustments that both Lou gave us and that we then proposed, I think the loss that you guys might have seen at $1.1 million, the difference between the unadjusted net loss of $1.1 million to the $431,000 was the cost report receivable adjustment that was about $660,000. So that's the big difference in the bottom line. If you were expecting the $1 million loss for the year. When I plot out the net revenues, really, what shows is 16, 17, 18, and 19, as far as net patient service revenues, are all recovering. I'm going to read some numbers. If I go back to 2016, your net patient service revenue was $8.1 million. 2017 went down to $7.7 million. 2018 was a strong year at $8.4 million, and now you're down to $8.2 million. So we've hovered all between $8 million and $8.2 million for the last 4 years. All the while we've continued our expenses at a pretty flat base. They were for the last 3 years. When I looked at total operating expenses, they were at $10.2 million in 17, and they were at $10.2 million in 19. So very flat when you look at over the last 3 years for both revenues and expenses. When you look at the end of the day. So the big story then is to what would, I know you as board members get asked this question, or I find that board members get asked this question all around Texas is, what are the tax revenues for? If I were to take your net loss for the year of $400,000 and I would back out your tax revenues, the loss for the hospital at that point would be $1.8 million. So I think it's still very, very important that the tax revenues continue to be looked at as a very vital part of what it takes for your program to survive. But then I also looked, you benefited net $434,000 on labor money and over $75,000 on the nursing home supplemental dollars. If I take out those and look at what the hospital would really be without any of those supplemental payments, you'd be at a loss of $2.3 million. And I think when we look at hospitals struggling all over Texas, we really look at the benefit that we receive to survive from both our community and our state to get us from that $2.3 million loss up to the $400,000 loss. Seems crazy, but we depend upon it greatly. When I look at your days cash on hand compared to your peers, at 2019 you were averaging about 45 to 50 days cash on hand. That number is lower than your peers that are in the 100, probably 90 to 120 day range. So when I look at your tax position, while you've never really had years that have had very much cash on hand, you definitely can continue to stay below the average in that category. One of the things to look at for critical access, and as much as it is how many days that you've got, to me the mix of Medicare patients to any of the other patients is very critical. The mix of other patients went down in 2000. So when I look at the decrease in your days, I look at really the decrease went down in categories other than Medicare. So your Medicare days didn't decrease near as much as your non-Medicare days, which hence is the reason for the really strong Medicare receivable of $660,000. When I looked at discharges, you were very constant. You had 100 discharges in 2018 compared to 101 in 2019, which honestly leads me to believe Billy's theory with the Athena revenues not being recorded when I looked at total number of discharges being fairly flat. It's really hard for me to talk about slides that you don't have in front of you, but when I look at your relative inpatient, outpatient, and rural health clinic revenues, I don't see that you're out of line compared to your peers. The only thing that looks out of line compared to your peers would be your salary expense is going up as a percentage of net revenue. And the reason that it looks that way is because net revenue came down and total salary and wages went up. So that's about the only category when I look across the board that shows an increase and a bit higher than your peers. There are any other expenses that give me great alarm. And when I look at your supplies, you really look very strong compared to your peers on a lower percentage of net revenue. Does anybody have any questions? And I am so sorry I'm not there. I really am. It's easier for me to talk to you when I see you than when I'm on the phone.
It's happening to a lot of us. I'm a teacher and we're having the same problem, so don't worry about it. You're doing a good job.
Okay. So, that's my report for the numbers. If you look at your internal control letter that you've got, the packet that's stapled separately, the letter, if you read it at your leisure, and I believe all this stuff starts on page 4, if you read it carefully, here are the problems that we bring to your attention, and it's nothing new. We talk about segregation of duties in detail, about accounts payable and accounts receivable and payroll, and the gist of it is I don't want to tell you to hire more people by any stretch of the imagination. I just think it's critical for management, for Billy and Lou to work together with the team to make sure there's checks and balances in place to make sure everybody's checking each other's work. The other item that you'll read about refers to audit adjustments, and I have the utmost confidence and respect for Lou, so this is not anything negative towards him. I have to tell you, I think Lou's been fighting a battle using the Athena system, and the audit adjustment comment just kind of reassures that the Athena system is causing him havoc on being able to pull reports and provide enough information to do the financial statements that really meet his satisfaction, much less probably the auditors. So the comment there about audit adjustments, I would tell you is much more directed at Athena than I would tell you it's directed at Lou, for what that's worth. So when we talk about moving forward, I've had some pretty intense conversations over the last, couple of weeks with Billy and her team, and I'm starting to get the distinct impression that this building project is creating not only havoc for getting it done, but a cash strapping for the project going over. When we talk about moving forward, there's no question getting the project done and figuring out the cash strategy going forward are probably the higher priorities on your list than worrying about this audit from 2019. So when we talk about how to improve the cash strategy, I would tell you there is never a more important time to worry about collections in the billing processes. While I don't have a lot of confidence in the Athena financial reporting, I will tell you that my audit team gave me a comment, and I read it here a minute. We think Athena does probably a decent job of collecting the low-hanging fruit, but the big problem with the Athena system is just lacking follow-up on the long term to bring in additional accounts receivable. So Billy, I would tell you that that's one area to focus on in your fiscal year 20 is the back-end collection. Continue to try to collect on the patient accounts. She indicated that there is a discussion on moving back to CPSI, and I have way too many clients that moved to Athena under the impression that it's going to be a great system for less money. I would tell you, I just don't see anything in Athena that is a long-term prospect. So the thought of moving back to CPSI in fiscal year 2021, to me, looks like a very important option for the financial viability going forward. When we started working with y'all several years ago, ago, I can remember that there was no ability to produce financial statements, and the ability was very challenging to get bills out. And I certainly would not want y'all to move backwards into the Athena system and continue to have problems with financial reporting and collection. That is just not the way it works well. So I don't have anything good at all to say about the Athena system for what it's worth.
Neither do we.
Amen.
I don't. I've got clients, I've got about 5 or 6 clients that switched to the Athena system, and I have to laugh. I think I told y'all this was a bad idea. I think it's a bad idea. A long-term with Athena is a struggle. It will be a constant struggle for financial reporting and collecting. So I do think that you guys had your hands full with the Athena system and the building project long before you even had any COVID-19 issues. That I think that I've got great concerns on what those are going to impact you here over the next 2, 3, 4 months. Anyway, that's kind of all I have to visit about. Does anybody have any questions?
I don't.
No, Linda, or Billy. Nope, we're good with your report.
So I'm sorry it's different. I'm sorry it's not the greatest report. We certainly had better reports over the years. What I would challenge you with is 6 months into your fiscal year 20 is to start putting full force ahead on trying to get fiscal year 20 under control. So I don't think the last 6 months are going to be easy.
Would you repeat that one more time?
Yeah, knowing you're just 6 months into your fiscal year 20 and all of the challenges that you've got with Athena and your building project,
Yes.
I would tell you to don't let's foot off the gas trying to correct some of the issues, because I think COVID-19 is going to negatively impact you. And I think that the 1115 waiver dollars going down and COVID-19 are going to make your challenges even bigger. So I don't have any good. It is a gloom and doom report for fiscal year 20 for all rural hospitals in Texas. Much less you guys dealing with your nursing home building project trying to get completed. I think you guys had your hands full. I wish I was there to help.
I wish you were too.
Yeah, absolutely.
It is what it is, as they're saying nowadays.
Well, that's just not good enough. It just doesn't work. Billy will be sending out some stuff in the next day or two, talking about some things to look at for COVID-19.
Okay.
I'm always here when you need me. Okay.
Okay. Yeah, I'm sure Lou and I will be talking to you soon.
Okay.
Thank you so much.
If y'all want to call back, Billy's got my number. If y'all have any questions, I'll keep my phone very accessible if y'all have any questions.
All right. Thank you so much.
Thank you. Thank you, Deborah.
Thanks.
Okay, bye guys.
Bye.
Okay, so it wasn't as bad as I was anticipating. I'll say that.
Well.
It's bad enough. I went to a meeting on COVID the other day and was talking to another CEO in the area that has Athena, and he's in year 2 of his. In his first year, he didn't see a lot of changes. Year 2, he's seeing around an $800,000 loss. So what's important is about what she was saying about we're 6 months into this fiscal year. We are going to keep clawing and scratching to get everything out of Athena's system that we can to try to minimize the losses from this year. Because, you know, even though we implement CPSI this year, it won't take effect until next fiscal year, 21 fiscal year. So when they have that full year of data. So we are by no means letting off the gas in that area of staying on it.
So are y'all kind of rechecking their charges to make sure they did send
We
out?
are,
And then checking to make sure everything was?
We are. So the process that we're taking is we're getting a detailed report from CMS of everything that is billed to them. It's called a PSNR report. And then we have, Kyle Lee is gonna go through and compare that with our team of what that says we billed and what actually got on a claim. We have tried and tried and tried just through the Athena system to do that very thing, and there's no way we've been able to find to do it. And this other CEO that I was mentioning had the same problem. He cannot find, we know it happened, we know why we think it happened. Just of course Athena is not going to help us prove it because of course that's their system. So anyway.
Are we gonna be able to find any of that big loss we had?
I'm not sure. We're still digging every way we can. That's why we're getting this detailed report to go through it. Every claim that we have goes through CMS. And so we're getting that detailed report that has every charge item on it and see if we can go back and find it that way.
So if they don't match, can you pull from the detailed report the items that weren't billed and send it again? How,
I'm not sure how we would rebill. Yes, I think so. To answer your question, yes, I think so. So we have everything that CMS says we have. If it doesn't have something listed, then I'm probably not ever going to find it. But if it has something and it says the charges went out, but yet we didn't get paid for it, that doesn't match up, then that's where we should find the discrepancy in it. Yes. So, and we're doing everything we can to find that. So, I know y'all need to approve the financials, but I just wanted to add that in for you.
Do I have a motion to accept the audited financial report from BKD?
make that motion.
Second.
Belinda and Irvin, all in favor? Motion carried. Moving May election to November.
Okay, so COVID has everything shut down, as you know. The Secretary of State, and I'm sorry, Caitlin, I don't mean to step on your thunder here, but Secretary of State put out a thing that we can change the election from May to November if we wish. We just have to do an order of election. And so if that is what y'all choose to do, then we will get the order and we will have to call a separate board meeting to take action on that order. But what I want to say about that is the school board has to partner with someone, and their board meeting is tomorrow night. So I'm kind of hesitant in the fact that I want to know what the school is going to do, before we make a final decision on it. And so, I mean, it's up to you, whatever y'all think. To me, it doesn't matter either way. I just don't know if we're still shut down through July or August, which is what I heard President Trump say the other day. I don't know how many people will get to vote. But again, since we're partnered with the school, kind of like to wait and see what they say. But I mean, it's up to y'all. But Caitlin, did you print that and give it to him?
Yes.
The Secretary of State letter?
Yes.
So,
I think it makes a motion that we table this till we find out when school is having theirs.
okay.
Irvin seconded. Table it until school board meets. Okay. CEO report.
All right. Well, back to Athena. There's no financial statements available tonight because the Intact system, which is the piece of Athena that does the financials, this is the part that Lou works in, has been down and he has not been able to complete his needed work. So he was unable to get those financials to us tonight. So as soon as he does have a chance to get those finalized, he was working with the vendor today to try to get back into the system. So as soon as he can get those documents finalized, we will get them sent out.
Okay.
The next thing is, I'm going to preface this statement with the fact the news publication that is in the room filming this meeting is not the one that will be referred to in the following message. There is a different news publication requesting public information in the form of accounts payables, which are check registers, with patient names listed for refunds due to overpayment from insurance or double copays being paid or something, for an example, that's for example. The documents have been sent with the names of patients and account numbers redacted, not the amounts of checks, the checks were written for. The publication is requesting that the patient names not be redacted, and this request has been sent to the attorney for review. However, it is my belief that this would conflict with patient privacy and HIPAA laws, plus the fact we are a very small town and people would stop trusting us if their personal names and business were appeared in a public forum. There is a photo attached of the redacted information. And also behind that, you will find the latest public information request received from this publication as well. And that says, to whom it may concern, pursuant to the state open records law, Texas Government Code, Annex Sections 552.001 to 552.353, I write to request access to a copy of any and all accounts receivable reports, which that's not a single report, accounts payables reports, 2019 to 2020 financial audit, which we just approved, and all bank statements for the Stonewall Memorial Hospital District from January 2019 until present, March 20th, 2020. If your agency does not maintain these public records, please let me know who does and include the proper custodian's name and address. That person is Caitlin, and so it's been forwarded to her, and you can see she was included in the request. As provided by the open records law, because such records should be readily available, I will expect your response by 5 p.m. Central Time, no later than May 1st, Friday, May 1st, 2015. See Texas Government Code Annex Sections 552.221D and 231C. If you believe this information is not public, I ask that you immediately notify me and then seek a formal decision from the Texas Attorney General no later than 10 calendar days from your receipt of this request, as required by the open records law. See Section 552.301. If you choose to deny this request, please provide a written explanation for the denial, including a reference to the specific statutory exemptions upon which you rely. Also, please provide all segregable portions of otherwise exempt material. Thank you for your assistance. Tiffany Waddell, Editor, Aspermont Observer. Yes. He just read her motto, shining brightly in the Devil Mountains. Okay. So the next thing I have is a CPSI status. I've been working with CPSI on this contract since we spoke last month about it, and I've managed to arrive. There's attached, the next sheet in the packet is attached, at the following cost for services. So the monthly would be $19,992.91. That's just for the software products as a package. And then that includes the charting software, the billing, payroll, GL, all of those things are in there. So the implementation cost is $379,348. I was able to get a 25% discount. They were offering a 20, and I got them to get us another 5 off of that. So this is down from what that would have been. This will be broken down into the first payment being in April of $10,000 down. They need money on the books for them to schedule our implementation. So they allowed us to do just $10,000 down, and then our payments for the next 11 months would be $33,577.09. So when you add that to the implementation fee and the monthly fee, then we'll be paying the $53,570 for 11 months. So the first month will be $10,000, and then we'll be paying the $53,570 for the next 11 until that implementation fee is paid off. They're allowing us to break that in, to the 12 equal payments without interest. So, and then we'll go back down to the $19,992 going forward. So, it'll drop. Athena's been running us, if you average the full year, it averages about 17, almost 18,000. The last 4 invoices have been 20,000 plus. So, I mean, this is pretty well in range with, kind of what we've been paying. And we will also, of course, we know we can do our billing and get our GL straight, so big benefit. So,
How come what do they base their invoicing on? Why have they gone up? Why has it gone up?
they have ADP in there, and they've added all kinds of charges for that. Their GL services, I think what it was is they were supposed to charge their percentage and then pay those companies out of that percentage. And I think since they are not supporting that product, they're probably not making enough to do that, so they're kind of bouncing that back on us. That's what I think.
That's Athena or
Huh, I'm sorry.
Athena or
Athena, yeah, yes. Any questions about that? Are y'all good with? The contract's already been approved. I just want to get final numbers for y'all to see. I have not signed the contract. I'm waiting until tomorrow because I wanted to make sure y'all were good with the final numbers that we came up with. And I bare bones this down to everything that I could. So, if you had Chase on the phone, he would tell you I've been a thorn in his side. Okay. So then the next thing I have is the loan status for the construction project. Spoke with, I didn't speak with, got an email late this afternoon from Ted Christensen, who is the financial planner that is helping. He helped us with the bond originally on the project, and he's helping us now with the new loan. And so he's asking for some more information. I got that information from him too late to get my report changed, so it's not reflected here. But he wants some assessed values for the last 2 years for our taxes, and so I'm gonna get that information to him in the morning. And then I think he was waiting on getting the financials officially accepted before they make a final decision. Of course, with COVID and everything hitting the economy right now, all banks are very nervous, and so I understand why they're very cautious. I mean, I get that, but we need an answer.
Let's try.
Yes, but hopefully within a day or two. So what that might mean, I don't know what the steps will be for us to finalize that, so I may have to call a special meeting for that. So just be aware, I will let you know as soon as I know something on that. Okay, so I have tried to narrow down all of the things that we are doing for COVID and around COVID. And this is a synopsis that Lavinda put together. It seems like we're doing 20 things at once with COVID. So you know that we've closed down the hospital. Well, we hadn't closed the hospital. We've locked down the hospital and made the entrance in the front door. So you have to come through and be buzzed in and get screened. The clinic the same way, both the east side doors. The nursing home is on complete lockdown, no visitors in there. The clinics are limited access as well, so there's no walk-ins in the clinics. Med refill, so if somebody needs a refill, they're just, instead of having them come in, they're automatically giving them a 30 days. If in 30 days we are not out of this situation, then they will probably just call in another 30 days until we get out of this pandemic. Routine labs are not being done currently because of the shortage of the vials that we need to draw the blood. And that's a direct result of everybody, needing them, of course, for this pandemic. So as soon as we can get more stock in, we will continue the routine labs to continue the maintenance health of our patients. So, I don't know if you want me to read this word for word, but she broke this down into different categories. Administration, of course, we're learning as much as we can. We're trying to help find, supplies, try to pass out information, educate as much as we can. Central Supply, poor little Shandy, she's, everybody's wanting her to order stuff at once. And so that's very difficult when there's nothing to be ordered. But she is watching the allocation list. She is keeping us on the allocation list. And so if they're giving us 5 things, she's getting all 5. And so that we don't lose our place on the allocation list, basically. We by no means have a big stockpile. And so it's a little unnerving, but they keep putting out reports that, shortly they'll have more supplies. Harbor Freight did come up and say that they would donate their N95s and other supplies to hospitals. And so there was a form we filled out and submitted for that. So any way that we can find a revenue or avenue to get any of the needed supplies, we are putting our name in the hat. So we'll just have to wait and see how that all works out. The biggest thing is not having the PPEs. We are trying to set up a COVID clinic over in the old wellness center in the Double Wide, so that this is a model that we took from Hendricks. So if they have somebody that's running a fever, may not necessarily be COVID, but they have a fever for whatever reason, we're trying to put them over there instead of bringing them in the building and rule out, is it strep, is it flu, we're still in the flu season, is it any other, thing before we, the state's not testing for COVID, so we're not testing for COVID. Bless you. So to try to keep this building as well as possible. And so that's what Hendricks is doing. They have a clinic off-site that's not open to the public. The provider has to do a screening and say, okay, you meet these check marks. You've traveled, you've been with in a car or been in close proximity to someone who's traveled in either the hot spot or out of the country, basically out of Stonewall County, really. Because now we're getting so many hot spots around us. And so then it's the provider's recommendation that they go over to the clinic. We have a process set up for lab to be taken over there to rule out the fever and the symptoms, and for portable x-rays to be done over there. So hopefully that will help keep some of it out of here. Just lost my train of thought on the COVID.
When they call in, will that be determined then whether they come here or go over there? Or?
Yes. And hopefully everybody's being completely honest with their travel plans. It's really based more on your travel than do you have a temp. That is one of the questions you will be asked. In a lot of places before you come in, and even we are of employees, when you come in the morning, we're scanning a temp, and before you leave at the end of your shift, we're scanning a temp. That's just some of the practices that other hospitals are doing. I don't know if that is effective, but that's just one of the practices that the guidelines that we've put out. What else? There's a million things I can tell you. Of course, we're trying to keep all the documentation together. At some point, we feel like there will be a reimbursement program. We're watching Congress is now trying to pass a bill to help small businesses, and they're not agreeing on it. So we're watching that very closely to see if there will be any kind of immediate help. But we feel like at some point, based on historical programs, there'll be a point where we maybe can put in, furnish some assistance. So we're watching that very carefully. We also are going to use this for our disaster drill. Every year we have to do disaster drill, whether it's a tabletop or real life. Well, we're living this one, so this is gonna be ours for this year. So, learning a lot, from that, as we do from every drill, every year. We did postpone the grand opening of the new nursing home, until May 20th, and that may even get postponed even further out, depending on, the situation as we go through April. So, that's tentative at this point.
Is it complete?
It is almost complete. There's a couple of little things. We have to put some cement around a box on the sidewalk, so we have a 5-foot walk around before we can pass inspection. I think there's a few little details. I did not make it over there today.
I noticed they never have got those screens or whatever over those room units of that last 6 that they had to put in, that were stolen. They don't have the full screen over them yet.
Oh, I did not
I want
realize
to
that.
say they removed those to touch some stuff up, but I'm not sure because I
He
think,
was never there.
oh, they weren't over there.
I look every morning, every day, and that's why I go to my place.
Okay.
Okay. Nathan, will you help me remember to talk to Kobe about that?
Mm.
Okay. So I have not been over there today, so, I don't know 100%. It's very close, if not,
Yeah.
When's the furniture supposed to come in?
furniture's there.
Oh, it is there?
Uh-huh, yeah, they brought that last week? Week before last?
Week before last.
Yeah.
It
So
was like the
will,
13th, I think.
That those 2 cargo trailers kept running back
I
and
think
forth.
so.
Yes, those 2 8-foot trailers kept going back and forth to Lubbock, yeah.
will an inspector come with all of this?
No, they will not, so it wouldn't matter. Until they remove the restriction, nobody's traveling. And as a matter of fact, our level 4 trauma designation inspection that was coming up has been postponed because that inspector's not traveling either.
Casey told me that life safety, we could actually get them for this at the drop of a hat because the only surveys they can do right now are initial openings because there's no residents in there.
Oh, okay, okay, that was new information to me.
So-
Last time I was told they weren't
Supposedly.
traveling.
The guy that did, she spoke to the guy that did our inspection just a couple weeks ago, and that's what he told her. So, sorry, I didn't know you weren't aware of that. But
Mm-mm, no. Yes, sir.
Back to the corona, if we do get a patient that tests positive, do we put them over there, would we ship them out? Do we have
Yes.
any way to isolate them here?
We do not. We don't have ventilators, but we do not have, we have one shared ventilator between us and EMS.
Okay.
And so, no, we could not house them. We would have to ship them.
And a positive coronavirus test or case does not automatically mean ventilator.
No, it does not. Normally, in a healthy adult, it will mean to send them home to recover and self-quarantine. Plenty of fluids, vitamin C, rest, those things. It would be only in those elderly or more susceptible because their immune system is depleted for some reason, that would probably get to the point of needing a ventilator. But they probably will not be in our area when they get to that point anyway. So we're having a lot of issues. One of the things we learned is daycare. Going forward in our disaster plan, we are going to have to come up with a way to have daycare in a situation like this for our employees' kids. Because thank God the community daycare is open, and that's great. And I certainly do not want to get in competition with them. That's not at all what I'm saying. But I have several employees that day to day it's iffy on if they're going to have someone to watch their kids. And so that is a big concern that going forward we are going to have to figure out a plan for. So any ideas, I would greatly appreciate that. Martha, you want to homeschool all of them?
It's an experience right now with 3.
Of course, all the same, precautions. Wash your hands, don't cough on people. That's universal precautions that we should be using all the time, just, good personal hygiene. But we're just reinforcing that. If you can't wash your hands with water, use hand sanitizer, and then do wash with soap and water for at least 20 seconds. Don't touch surfaces. Clean your hard surfaces frequently with Lysol works, Lysol wipes, Clorox wipes, bleach solution. What else? Heather? Yeah.
No need to wear a mask in public.
Yeah, you don't have to wear a
Yes.
mask in the public.
I've seen people, I'm not sick, but they have on a mask. Okay, you are the reason there is a shortage of masks.
Yes.
It's people like you.
Mhm. That's exactly right. So. Okay.
Okay, do I have is that it?
That's it.
Do I have a motion to accept CEO's report?
Second.
All approved? Okay. Foundation report?
Well, everything's on hold, so no report.
Y'all are still selling tickets and it's.
Yes, it-
Tickets not due till, it's gonna be the second.
Yes.
Possible.
Yes, unless we'd like to coordinate it with the grand opening. And so it may get delayed again, depending on what happens with the open house, so.
How are the ticket sales?
We still need to sell about 50, 75 to meet the price of the ticket.
Yeah.
But also the problem with the coronavirus is it's hurting the economy, and so nobody and I don't blame them, I mean, I'm the same way, doesn't want to throw out, $150 on a chance, even for a pickup. And so, I mean, I get that, which is why we extended it out. So, the overall economy is killing us in a lot of ways.
Yeah. Good news, I heard you didn't have to pay taxes till July 15th.
Yes, yay.
Randy was thrilled. All right, information only, okay? Financial officer report. Lou?
Yes, I'm here. I unfortunately don't have a lot of information. I can say that not including the nursing home, we booked $860,000 gross patient revenue for February. So I think that when they are completed.
They are, hello? We lost you. All we heard was 860,000 and that was it.
Okay. Without the nursing home, we booked $860,000 worth of gross revenue.
Okay,
We had about $100,000 to that from the nursing home. So we approached $1 million of revenue in February. This point, it's premature for me to really talk about costs, but given that kind of a top line, I think it's going to be a pretty good month.
okay. Well, at least that's encouraging news after what we've heard, so that's,
Yeah.
We appreciate you giving us one.
I hope that we have several more months like that. I don't know, but I hope.
okay. Okay,
Yeah, the next 6 would be great.
really, really.
Yeah.
Yeah. Okay, anything else that, sooner we can get to
Nothing in particular,
CPSI?
but, it's just, it's need to move forward, and I hope that the conditions let us do it smoothly.
Okay. Okay, thank you.
Sure.
Nursing home, Nathan, tag, return.
All right, so had quite a bit of overtime. Good news is our staffing is improving to where hopefully we're not going to have to ask so many, and it's predominantly nursing staff, and so hopefully we're not going to have to ask people to work extra hours, and so I think the improvement in staffing will help that, and then Cynthia and I are working together to try to tighten down a little bit, might improve that as well. As far as projects, I put moving preparations because we're still got that on our mind. Again, excuse me, we don't have a move-in date, of course, but trying to think through some of those processes. We've been working through how to assign rooms based on which residents might benefit from being closer to the nurses' station and such. So trying to get all that in line so to make the transition as smooth as possible. Now we had several people from the community volunteering to help move, so with this coronavirus that'll probably affect that, but good news is we're not going to be moving a lot of furniture. You know, it'll be, since we have all new furniture, it'll mainly be their things, which will still be a little bit of a chore, but nothing compared to what it would be like to move all the furniture too. So. Excuse me, and then with our with our drug diversion,
You want to spray him with sanitizer?
I think I may have mentioned this. I think I may have mentioned this last board meeting, but we were cleared by the state during their inspection or during their survey for that drug diversion, and they were pleased with all of our interventions that we put into place. So
They even kind of commended them on the processes they put in place to prevent that from happening again. So
yeah, and hopefully it'll help it not happen again. So
yes.
other than that, I'd say the biggest things of note are to do with activities. Some of y'all may know Karen Salazar. She's kind of like our Swiss Army knife. She's a CNA, but she has her activities license. She can transport. So she does a lot of things for us. And she's stepping up to do some things to help Rhonda out. And one of those is the music therapy. We're going to try to implement that, and it's got a lot of benefits as far as helping memory, improve moods, stuff like that. So we're excited to implement that. She's doing hand massages and aromatherapy and stuff like that when she can. And then she's going to try to help out with having more of a Facebook presence once we get the admin login and everything for that too, especially with the lockdown, to post pictures and different types of updates or whatever it may be to continue to keep the community and especially the residents' families in the know, and so they don't think that they're doing poorly, being kind of isolated, but they're actually doing pretty well. They don't allow us to really do communal dining right now, and group activities, but we're still trying to find ways around that to still stimulate them and just keep them thriving as much as possible. We've started doing some FaceTime with those that want to do that, and that's been really helpful. So they're doing really well, all things considered.
Looked like they enjoyed the Coke floats yesterday.
Yes, ma'am. So hopefully we'll have more of that.
I
so that
always
everyone-
love those.
They
Yeah,
do.
it's always a big help. I saw a thing on the news this morning. It was in another country, but it was a nursing home, and they had residents in a circle, all in wheelchairs, and they had a stick with a plastic basket, like a square plastic basket tied to it, upside down, and then they had all these big round, those plastic balls, that are about this big, and so they gathered those up, and then they would. Employee would roll them in,
yeah.
and they were playing Hungry Hungry Hippo, and so they would try to catch the balls, and that was the greatest thing ever. That was so cool.
Very good. Okay, anything else?
I think so.
Right. Have a motion to accept his report. Sandy and Irvin. Motion carried. Department head reports. Any
Did we
questions?
ever accept the financial report?
It was discussion only, because we didn't have anything. So the laboratory deal is kind of being bypassed electrically, but still working, right?
Yeah, it's in
Is
the
it
piece of
machine?
equipment itself. It's still showing low voltage, but it's the machine. They've done everything. It's not the electrical line coming to it, it's the voltage meter inside the machine.
Is the machine people coming to check it, or?
Well, they were, but I don't know now
Nobody can
when
travel.
that will happen, yes.
Okay,
I don't have an update on that, but no, they're not allowed to travel now either.
okay. Any comments or concerns about the department head reports? Have a motion to accept them as presented.
Make that motion,
Belinda,
whatever.
Sam,
Second.
oh,
No, Bill
Billy, second. Motion carried. Okay. Quality performance reports.
That's in the note.
So have we found out anything about the washroom? You know, about they were gonna have to redo? No?
That was not true. That was just, they were trying to sell us something. So,
No.
I'm kind of concerned for a few minutes though, because I thought, oh no, if we miss some regulation and we have to change the laundry. There was a company came on trying to sell us management services over the kitchen dietary, which we've been looking at, having someone come in and help us manage the food and going forward in the new building. And the guy looked at our laundry room and said, oh, this is an OSHA violation, you only got one door. And I was like, oh, no, we're almost done. No, I'm not hearing that. Well, come to find out, it's, OSHA's the wrong company. They wouldn't have said anything about an extra door anyway. But no such regulation. Our laundry room is fine. I think they just wanted to move their linen service into our clean room and not, or into the dirty room and not have a clean room or something. And no. So we're not talking to that company again.
So, but what about the kitchen, that, you know, was the wrong way or something, you know?
We actually had Airtight come in
Uh-huh.
and they're building the left-hand flow. It was,
Okay.
what we had was a right-hand
Right-hand
flow in
in,
the
right.
dish machine, and so they're
They're-
building, yeah. And so we're getting a leased unit from US Foods, who we get our food from, and Airtight, it's gonna cost us about $7,200, but they're gonna build it going the right flow, so we have that fixed. We're gonna have that fixed. I'm not gonna say it's over there yet, because like I said, I haven't been over there today, but
Yeah.
anyway, yeah.
This might be, yeah. Other than that. Have a motion to accept our quality performance report.
I'll say.
Irvin and Sandy. All in favor? Motion carried. Medical staff, anything?
We don't have anything. Of course, he's working with us on COVID and, you know, we have a task force we put together that we're gonna meet every Monday morning, to discuss the new situation each week. But other than that, really.
Okay.
Well, say we did have a patient that tested positive, and we transported, did our ambulance personnel have their proper equipment?
Yes,
The
they're,
mask and all?
they have limited PPE as well, but they do have, yes.
Okay.
And we're also trying to get enough to share. I know there's some state agencies that are working to get stuff out to EMS services, sheriff's departments, hospitals, but all those other responders, first responders as well, they're trying to help. So everybody's scrambling for the same things right now, so.
Okay. Next regular meeting is April 27th at 6 o'clock. Anybody else have anything to say or comment? Anything on the financial? Sandy on the, well, it's kind of back on this. What's your question?
Well, so this is what was redacted, and she's got a complaint about that.
Because it has the patient name and the patient account number, medical record account number. And so that's two forms of patient identifier. And so that was redacted.
So she's saying that we're hiding.
Yes, because we should publish the patient names in there. And I believe that that's against HIPAA. Of course, that will go absolutely to the Attorney General through our attorney to get a recommendation. But, I mean, how would you feel if your name was on that list and you were part of the community and you're like, it ends up in the newspaper, you know?
Where's all that coming from?
I don't know.
We're still on camera, so just to be humble,
I'm sorry, what?
we're still on camera. I mean, some of this can be discussed. I mean, well, we don't know why it's coming
It's
from.
pretty open.
Right, we don't know what it's coming from. We don't know what's going on.
Yeah, I don't know.
But we do not hide things. I do not believe that we've ever hidden anything, and I don't think we ever will.
No.
So, anybody want to make a adjournment? Billy! Yay! Do I have a
Motion
second?
that we adjourn.
Adjourn? Who's
I'll
gonna?
second it.
Irvin seconds it. We're to adjourn. I noticed you got that .2 patient off your list.
Well, yeah, we added
Just-
another one, so
There's just
next month.
there's not 20